Hi, Armando.
Hi, doctor.
How are you?
Good, good.
Armando, tell us a little about yourself and your occupation.
Yes, my name is Armando Caterini. I'm also known as Al, and I retired from Northrop Grumman after 21 years working for the Air Force. I have a total of 10 with the Navy and about 30 with the Air Force, so I'm happily retired. Um, my occupation is a retired engineer, and I've been all over the world with them as a electronics engineer.
Thank you, Armando. Armando, can you share with everybody what your dental history was when we first started, what had happened, and what you were experiencing?
Well, I've been in a county since 1984. And the first 28, 30 years, I had what we're going to call him a doctor number one. And it was a lot of maintenance. My job was basically out of the country most of the time. So my dental work was sporadic, um, once a year type of thing. And I really didn't take good care of my teeth. So after the 28 years, he decided that in the next few years he was going to retire. And he says, why don't we do this? Why don't I become your extension to another doctor? And he'll be taking care of you also. So I had doctor number two, and then we hire a doctor number three for the periodontal work. So I was working 6 months on one guy and
Mm.
6 months on the other guy,
Okay.
alternate.
That's so based on that history, Armando, what did you like about your mouth, your smile, and what you didn't like about that particular stage in your life?
Well, when we were young, I didn't really worry about, what people think about me because I was busy making money. And since I work overseas most of the time, just save as much as I can. And we're invincible.
Okay.
We can just do anything, but you don't take care of your body. And that's, eventually
It catches
it
up.
catches up with you and they send you the big bills.
Yes.
Yeah. And that's the truth with a lot of people who works for the government. A lot of pressure. You have no time to take care of your teeth.
I think it's valid for almost any occupation too, as well. I mean, I know just from experience of treating patients, it's very well prevalent in the US versus Europe, where we have a little more recreational time.
Yes,
But that's a different comment.
yes.
Um, how did you feel about your smile then, about 2, 3 years ago when we started, and how do you feel about it now?
Well, I I'm not a good looking man, so I
Oh,
really didn't worry about my smile, but I do worry about my teeth when I became a little older. And then of course, time went by rapidly, and the last 4 years I started to detect uh, malfunction on my teeth. And I I kind of went around and tried to hire different doctors to see how can they help me. It really wasn't a lot of choice, but 3 years ago I developed TMJ, and that was the beginning of my
your journey.
of my journey, basically, and that's when I checked around the county, and I came upon my neighbor, and my neighbor told me about you. And he says, hey, I've been with him for a while. I know him. I trust him. I said, well, if you tell me that, then I'm happy. I'll go make an appointment and see what he can do for me. because the TMJ was killing me.
Yeah. What was your biggest fear when you and I first started having a conversation about what I was understanding, what you were telling me, and it was quite different from what you were typically used to.
Absolutely. I was never afraid of pain because I've been to a couple wars, been married 3 times, so I lost all kinds of fear. So I just want to get back and take care of my dental work, you know. And I know that things are not gratis, you know. It's you got to do what you got to do, but I do need my teeth.
Armando, tell me why you trust our office with your oral health.
Well, from the beginning, I I felt very comfortable. Uh, the staff was fabulous. Yourself, you're just a wonderful person. You are very, very smart. Me as an engineer, I appreciate the electronics and the form that you do things. I remember the one time when I had a bridge, they had to send it out,
Hmm.
and then it came back, and it was metal and all kinds of different things. So technology advanced in the last 30, 40 years.
Yes.
So I'm comfortable. You know me.
Hmm.
I I would give my life for it because that's just how grateful I am.
You're absolutely correct, Armando. You have a very high IQ in engineering. You have a very high IQ in general, and you're very deductive in what is wrong and right. Do you think the format that we use, where you're able to see what I see, all the steps by approaches, making intelligent decisions together, does that have an impact on how we earn somebody's trust and how we move along? Because you've had some pretty complicated procedures done without sedation, without,
Yes.
and it hasn't been all easy. Some of it's been sensitive and painful. And talk about those
Yeah.
experiences a little bit.
Well, my biggest experience with medicine in general in the last good 20 years, it's gotten worse. And doctors don't look at you like a person. They look at you like a number. So therefore, you lose that touch.
Yeah.
With you, it's totally different because it's you just an open book. You tell me exactly what's going on, and I don't like anybody to sugarcoat it,
There's no
and
reason.
a lot of them do, just to get you away from it.
Mm.
And come in, get the laptop, tell you what you want to hear, and out the
Yeah.
door. But this is personal.
Yeah.
This is very, very personal, and I love that, and I really appreciate it
Thank you.
very much,
Do you think we've impacted your quality of life?
very much so, very much so. Um, I travel the world,
Yeah.
and cheaper is not always better. You can go to Europe, you can go to Peru, you can go to South America, anywhere, and a lot of people think that they're going to save money, but you got to get somebody local who can understand you. And I'm advocate about that. I mean, I
Yes.
can I can advertise you anywhere because I trust you.
Thank you, Armando. I I'm a little bit of loss of words because you're being so kind. What advice would you give other patients who are in your similar situation?
Well, first of all, they have to look at themselves because we're all individuals and we all are individual custom made. So you got to realize that you love yourself, you care for yourself before you care about anybody else.
Yeah.
And a lot of people don't do that. And I understand the economics is number one.
Yeah.
Fortunately, even we suffer about the economics. you know. But if you can't do it, this is a place to do it.
Yeah. And I understand this is an expense, and not only expense, it's time, effort, energy, and money, all four variables.
It's all,
But the other half of the coin is that in your situation, we haven't lost any teeth. We haven't had to do surgery. We haven't had to do dental implants. So not only is it more organic, it's also less invasive and less expensive. And the engineering that we've gone through with all the testing and the biomechanics and the TMD and the appliances, your longevity should be. Remember early when I first talked to you, I said our goal was very simple, least invasive, most predictable way to get results that last.
yes,
That's always the criteria. Do you think
yes.
we're
I think you're there. You know, you have achieved a lot of that stuff with my body. And unfortunately, my teeth is going to outlast
don't say
because, I mean, my body's just breaking down. And
you've been through a
and
lot
I'm
of
trying to
this.
eat
Yeah.
well.
Yeah.
I don't drink, I don't smoke, I don't beat my body like I used to. Like I said, we were just invincible.
Yeah.
And this brings me a lot of happiness that at least my teeth, it's working much, much better than all the rest of the body.
Well, I do have to say it's my honor to take care of a gentleman like you
Yeah.
who had been through quite a bit, and I really had to find a way to earn your trust over time. I'm glad I've been able to do it.
Well, I really appreciate that.
Thank you.
Once again,
I'm gonna.
yeah, you guys are the best.
Yeah. Thank you.
Yeah.